All right, guys, so today I'm going to be talking about the most common disorders in the musculoskeletal system. So, to start off, I want to be talking about osteoporosis, right? So, osteoporosis is a very common condition. Osteoporosis. I can't talk about it at the same time. So, osteoporosis, generally speaking, occurs because a lack of calcium, deposition into the bone. And so that usually happens to women who are postmenopausal or 55 years of age or older. Usually by this time, menopause has already finished and they are no longer producing estrogen how they're supposed to. And so estrogen is a catalyst for calcium deposition into the bones. And because of that, since you're losing the estrogen because of menopause, a lot of women who are postmenopausal are at higher risk for developing osteoporosis. Generally speaking, the book discusses women who are of Asian and European descent. Okay, those are the people that are at risk. Also, thin women are at higher risk for developing osteoporosis than any other demographic, according to the book, right? So what you guys have to know about osteoporosis is that the bones become weak and you may develop what we call pathological fractures. Okay, and so these pathological fractures occur without trauma, and that's the problem with these patients. These patients could be laying in bed, and from repositioning or getting out of bed, suddenly they realize that their bone is fractured, and that's what a pathological fracture is. That's what's happening to people with osteoporosis, right? So what you have to do as a nurse is you have to be able to educate the patient as to what type of physical activity to carry out. And one of the most basic things that we can teach our patients is to do basic things like walking, okay? Because walking helps put more pressure. Weight-bearing exercises is the important thing. You have to bear some weight on the joints because that stimulates osteoclast and osteoblast activity, the bones that break down and then rebuild the bone matrix. So that's what you want to educate the patient about. When it comes to osteoporosis, you have to consider the diet, of course, okay? And what you want to do is you want to ensure that the patient has a high calcium and a high vitamin D diet. Usually vitamin D is going to be fortified, whether it's in milk or in other beverages. And then calcium, you have to find out what type of food items contain calcium. Usually green leafy vegetables, calcium. Broccoli, calcium. Dairy products, calcium. Even though it has phosphorus and there's an issue with that. But the book talks about dairy products, so that's what we're going to go ahead and do. And then when it comes to medications, you have to consider the following. Patients have to take biphosphonates, and the most common one is going to be alendronate or any other drug that ends in dronate. There's a few of them. And so what this medication does is it stops the resorption of calcium into the bloodstream, meaning it stops the breaking down and the reabsorption of that calcium back into the bloodstream, and it keeps it in the bone. That's what these medications do. That's normally the mainstay of the drug of the treatment because it decreases bone matrix breakdown and it makes the bone more strong and less porous. Now, when you're giving alendronate or any of these medications that end in dronate biphosphonates, it's important we consider the potential adverse effects. And adverse effects for this drug includes bone necrosis, osteonecrosis. Now, this doesn't happen to a lot of people. Based on the data, it could usually happen to up to 12% of the people that take this. But generally speaking, it's not that high risk. However, NCLEX asks you a lot about this potential adverse effect, so you guys have to know about it. This is why when these patients take the medication, you have to sit them upright while they're taking their medication, because you want that medication to go straight down into the stomach and not linger around anywhere, which can cause irritation and damage to the tissue. You're gonna have these patients drink their alendronate with an 8 ounces of water and ensure that it goes all the way down. And the patient is gonna sit upright like this for at least 30 minutes after the patient takes the drug, because again, if it gets stuck anywhere in the esophagus, it can cause damage to the tissue. So we have to ensure that the patient drinks all that water so it can push it all the way down and so it can do its thing. So patients who are taking the Londronate, you have to consider possible issues with bones. Even though it's supposed to help make the bones a lot more strong, it can also cause damage like necrosis, in particular to the mandible. So because of the biphosphonates, you're taking a PO. So ensure that you're looking out for any type of bone weakness or any indication that the bones are fracturing or any issues with chewing, because it can indicate that the mandible has been affected now. Okay. And that in essence is the gist for osteoporosis. I'm going to go ahead and move on now and talk about the arthritis conditions.